Hello, guys.
Hello.
Uh,
Teacher.
I think we need to start. I hope other guys will connect to us, but we need to start because we haven't time. My name is Kamzina Z.K. I am your lecturer in cardiovascular lectures, like about the vessels. Okay, we have 3 lectures, and I will tell you or discuss with you about them. And today, the first lecture. And to be honest, I want to tell you about something about myself. I am teacher in our university, and also I am vascular surgeon. Do you heard about this profession before? Do you understand what it means, vascular surgeon? Guys?
We know surgeon, but not the...
Yeah, you don't hear about this profession before yet with these doctors. Vascular surgeon or angiosurgeons. Angio in Latin means vessels. It means I operate directly in the vessels, in the veins and in the arteries. Do you understand now?
Yeah, we got it.
Yes.
Yeah, this is why I am your lecturer in these topics about the vessels. Yes, because it's my profession. Okay, guys, understanding? Yeah. And it means if you have some questions, you can ask me also. But for now, the first topic, I think we can start. Do you know other guys connect or not? Your classmates? Do you know, guys?
Sorry?
I think no one will join except us.
Okay, please tell others to connect, okay, to join, because I can tell you some information that will be asked in your classes. That's why it's important to separate here, to be here in the lectures, okay? Tell them they have some 5-10 minutes to connect also. That's for now. I need to start. Do you see my screen?
Yes, we see.
Yes.
Before my lecture, you listen lecture about the heart. Yes, you discuss the heart. You know, the heart have 4 chambers and etc. And the last topic about the heart that we need to discuss is cardiac output. Here. And as a result of this lecture, you will be able to define cardiac output and explain its importance. What is it? Identify the factors that govern cardiac output. And where is my here? This one. Also, factors that govern the cardiac output and some new nervous and chemical factors that alter heart rate, stroke volume, and cardiac output. And we also discuss these terms, what they mean. And also, we will explain how the right and left ventricles achieve balance output. It's important. We will talk about the hard work totally, how it's working. And firstly, cardiac output is CO. Yeah, it's amount ejected by ventricle in 1 minute. Okay, it means totally. We know that in the 1 minute, our heartbeat it's 60 or 70 beats per minute. Yes, and cardiac output means how many blood our heart eject during this all beats. Okay, per 1 minute. Understanding this?
Yes.
Right? Cardiac output is related to the quantity of blood delivered to various parts of the body. It is an important indicator of how efficiently the heart can meet the body's demands for perfusion. And the function of the heart is to drive blood through the circulatory system, we know it, and a cycle that delivers oxygen, nutrition, and chemicals of the body cells and removes cellular waste. And maybe some of you want to be cardiologists, yeah, or maybe cardio surgeons. And this is important to know because it's directly connected with your future profession. For example, we understand what means cardiac output, and cardiac output it's amount of heart rate multiplied to stroke volume. This is why we will discuss about each of them and which factors affect to heart rate and which factors affected to stroke volume, and multiply to this meaning to these things, we know the cardiac output, and it's about 4 or 6 liters per minute. It means maybe you heard before that in our body we have 4 or 5 liters of blood, yeah, normally, and it means the cardiac output. It's one erythrocyte that leave your heart. It's by minute it back to the heart. It's one cycle for one erythrocyte. You see, it goes from the heart, and after 1 minute, it's back to the heart. Okay, you see, cardiac output is 4-6 liters per minute. Yeah, here again we can see. Cardiac reserve, we have another term. Cardiac reserve is the difference between a person's maximum and resting CO. It's increase with fitness, decrease with diseases. What means cardiac reserve? For example, our cardiac output it's differ by when you rest or when you do exercise. Yes, if you see here, it's connected with heart rate. For example, we know that when we do some exercises, our heart rate increase, yes? Because we need more oxygen, more blood, and heart rate increased, and it means cardiac output increased too. Or for example, when you sleep, your heart rate will be decreased because you are resting. Your body don't need so much oxygen, so much blood. That's why cardiac output will decrease too. And cardiac reserve, it's difference between your maximum cardiac output when you do some exercises and between your resting. Okay, this is your cardiac reserve between this. For example, in your maximum cardiac output during your exercise will be 6 milliliters per minute, and your resting cardiac output will be 4. And 6 minus 4, it will be 2 liters per minute. It will be your cardiac reserve. Understanding this, guys?
Yes,
teacher.
And increase, if you guys don't understand, please ask me, okay? Now, it's increased with fitness. For example, if we talk about athletes, yes, they have more cardiac reserve because they are trained more and their heart eject more blood per 1 beat. Or decrease with diseases. For example, after heart attack, yes, I hope you learned before that cardiomyocytes after some diseases, after cardiomyocytes, after some, it's replaced by another tissue, yes? How we call this tissue? Guys, do you know?
Tissue?
Connective tissue, yes?
Connective tissue.
Yeah, connective tissue. And it's, of course, the heart with connective tissue can't contract like a cardiomyocytes, yes? It means after some heart attack, yeah? You hear me, guys?
Yeah, we hear you.
Yes.
Yeah, it means after some heart attack, if heart have some connective tissue, it can't work totally 100%. And it means his contractility will be decreased and cardiac output will be decreased too. Okay, this is why we see here cardiac reserve will decrease with disease. Because, for example, if we compare athlete with normal heart, his cardiac reserve will be 2 liters per minute, but sick person, yes, after heart attack, for example, his maximum level of cardiac output will be 5 only, or maybe 4.5, because his heart can't work to maximum. And 4.5 minus 4 liter, it will be only 0.5. Yes, half of the liter only. It means his cardiac reserve will be decreased. I hope you understand this. And now Dr. P. What here I said it before, red blood cells leaving the left ventricle will arrive back at the left ventricle in about 1 minute. It is cardiac output. Do you understand, guys, this term? Can we go to the next slide? Okay. I think you heard about the pulse. Pulse or heart attack is the same terms. Pulse is surge of pressure produced by each heartbeat that can be felt by palpating a superficial artery with the fingers. For example, you do it before, I think, the radial artery in the wrist or carotid artery in the neck. Yeah, do you do it before? Radial artery, do you see me or you see only slides? Guys?
Yes, teacher. We see you, teacher. Yes, we see you.
Okay, I hope you see. And for example, radial artery is here, yes, in the wrist. And if you palpate right now here near the first finger, you can find your pulse and you can count it. Or for example, carotid artery is located in the neck here. If you palpate it, or maybe you see it in the movies many times, yes, to check this person life or die, we check the pulse near in the carotid artery. Okay, you can try right now, guys, and check it. Do you find your pulse?
Yes, teacher.
Yes,
and
teacher.
yeah, this is the most abundant place where people check pulse, and it's important. And here, infants have a heart rate of 120 beats per minute or more. It's higher than in adults. Why? Because their heart is small, very small hearts. They have very small hearts. That's why they need more heartbeat. For example, here, if we back to cardiac output, it's heart rate and stroke volume. They have small hearts. It means stroke volume or volume that was produced by volume of blood that was ejected by ventricles per 1 beat. It's very small. For example, only maybe 2, 3, or 5 milliliters. That's why we need more heart rate to compensate it and increase our cardiac output. Okay, because cardiac output needs to produce all blood to deliver all blood to the body. Okay, it's compensate little stroke volume and more heart rate to our cardiac output. For example, here again, if we back here, in the athletes, some of the athletes have decreased heart rate or bradycardia. Because this heart rate decreased because of increased enlargement in the heart. Do you heard about the hypertrophy? What it means?
No.
Mean 1 beat for each part of the heart. I
mean the 4 chambers.
1 beat for each part of the heart. No. Yeah.
I mean,
yes, yes, I understand. Yes, it not each part. Where pulse, it means how to explain you. We have 2 terms: heartbeat and pulse. Heartbeat is how exactly the whole heart contract in one time. Yeah, our ventricles. Okay, mostly ventricles contraction. And ventricle contraction will eject all blood to the vessels. And when vessels go, or blood go to the vessels, beating of pulsation of these vessels walls, it calls blood pulse. Okay, it's a little bit different, but mostly pulse and heart beating is the same count. because after the heart beating, we have pulsation in the vessels. This is why for counting our heartbeat, we count our pulsation. Understanding this or not?
Yes,
Yeah,
teacher.
got you. But I mean, right? The heart have like 4 strokes. The blood go to the left ventricle, then the right ventricle, then the right atrium, then the left ventricle, then the right atrium. That's right.
Yeah,
so
they contract at the same time.
So when the heart do this for when the heart do this 4 levels or 4 steps, that means 1 heartbeat, right?
Yes, because it's contraction of the atriums, 2 atriums, and contraction of the ventricles, they happen in one time. It means they contract together and we have heartbeat. Okay, it's like firstly, you never see the movies, first contraction of the atrium, after that, directly after them, contraction of the ventricles and blood go to the vessels. It will be heartbeat. But mostly when we talk about the heartbeat, we talk about the ventricle contraction, because after only ventricle contraction give us deliver our blood from the heart to the vessel. Okay.
Okay, teacher.
Так, we need to go. Okay, here and again, in the young adult females have 72-80 beats per minute. Young adult males have 64-72 beats per minute. It's normally. Так, and heart rate rise again in the elderly. Так, now we have 2 terms, tachycardia and bradycardia. Maybe you heard about it before. It's from Latin. Tachy means speed, and speed or faster, and card means heart. It's condition. It means heart, fast heart condition, yes, in English, tachycardia. And oppositely, bradycardia, it's slow heart condition. Tachycardia means when our resting adult heart rate about 100 beats per minute. It's important when we talk about resting adult, okay? Because by physiologically, if you do some exercise, your heart beating will be increased because it's physiological condition, it's normally, but it's not tachycardia. Tachycardia, it's resting adult heart rate increasing. Because males have larger heart. Okay, if we back here to the cardiac output again, for example, cardiac output is amount of blood that that leave our heart per minute for our body importance. For example, what this 4 milliliters need our body for 1 minute for working, for taking oxygen and nutrition and etc. etc. It's normal, for example. And for males have more stroke volume, stroke volume is connected with the heart. If heart bigger, it have more stroke volume, and it means the heart rate should be decreased for normal cardiac output. Women's heart have less volume, stroke, or less heart, and their volume will be less. That's why we need more heart beating, okay, for normal cardiac output. Okay, understanding this? These 2 conditions connected. This is why males have less per beating beats per minute. Okay.
Okay, doctor.
Here, guys, we need to continue. We are only in the 7th slide, and here, you guys, you will read in the book these topics, and you understand more deeply. Okay, here next, tachycardia. This important, guys. Resting adult heart rate. Okay, resting adult heart rate above the 100 beats per minute, and resting adult heart rate less than 60 beats per minute. Bradycardia, tachycardia. And here examples for tachycardia: stress, anxiety, drugs, heart disease, or fever, or loss of blood or damage, for example, hemorrhage. In the hemorrhage, we also have tachycardia. Bradycardia, don't compare it, don't confuse it with your exercise increasing heart beating, okay? It's important. And next, bradycardia when you sleep, or low body temperature, or endurance trained athletes. They normally, again, I said you that in these athletes, endurance trained athletes, they have the ventricles hypertrophied and increased. The diameter of ventricles increased. That's why their stroke volume increased too. And they don't need so much heart rate to produce our cardiac output, normal cardiac output. That's why they have bradycardia. Next, positive chronotropic agents. Chrono means time, trop is changing and influence. It means some agents that increased our heart rate. They call positive chronotropic agents. And some factors that will decrease, yes, our heart rate, they will be negative chronotropic agents. These two terms is also important to understand. Why does the heart have a nerve? Okay, guys, why does the heart have a nerve supply since it continues to beat even without one? Who can answer? Who knows? Do you know, guys, that heart produce have automatically function? Yes. Ramil, Hasil, please tell us.
So, teacher, I don't know exactly, but maybe in some cases, teacher, for example, when we do exercises like running, yes, heart, maybe brain sends signals to the heart to maybe tell him to, so he should be a bit faster.
Yes.
Than the autumn it does. Or like in.
Yeah, it means we discussed, we learned about the heart that we have automatically function. Yes, heart, it means heart produce nerve signals themselves, but our brain can send the signals when we need to increase our heartbeat or maybe decrease our heartbeat. Is all connected with the brain. And your idea is correct. Because sometimes you need to, yeah, according to the situation. You're right, guys. It's understanding. Okay, next. Here, the autonomic nervous system can be defined as a motor nervous system that controls glands, cardiac muscles, and smooth muscle. Okay. Here we have cardiac centers. Yeah, some center in the brain, in the reticular formation of the medulla oblongata, that initiate autonomic output to the heart. And we have cardiostimulative effect. Some neurons of the cardiac center transmit signals to the heart by way of sympathetic pathways. Okay, we have sympathetic pathway and parasympathetic signals. Sympathetic pathways, they give signals to the cardiac center to increase our heart working. Parasympathetic signals by vagus nerve, they transmit some signals to cardiac center to inhibit the cardio effect. It means increase heart working. Okay, memorize it, sympathetic and parasympathetic signals. And here in this picture, you can see both of them. For example, cardio accelerating center here. From here, center descending to the upper thoracic segment, T1, T4 of the spinal cord, and the sympathetic preganglionic neurons here. They in the lateral form, they rise to the adjacent sympathetic chain. After that, in the ganglia, and they two fibers here and here, they give the signals through the cardiac plexus to the aortic arch, to the sinoatrial node, to the AVA node, to tell us to increase our heart beating, because this green is sympathetic nervous system, sympathetic pathway. Okay, they increase some signals. For example, when we need to fast run, yeah, we see some, or when maybe we anxious, and our signals from the brain give us a signal to the heart to increase our heart beating. Or, for example, when you need to run from some dog or somewhere, you need to more oxygen, and your heart beating also increase. It's signal from the eyes, you see dog. The signal go to the cardiac center, and after these pathways, it goes to the CA node and AVA node, and you start run. And you have this ability, okay, for running. You have this oxygen because your heart beating start to produce more oxygen, deliver more oxygen for your muscles. Okay, understanding this? And here, the red one, this side, it's a parasympathetic pathway. From the medulla oblongata, they go directly by the vagus nerve, right and left, and right go to the CA node, and left one go to the AVA node, and they decrease heart beating. For example, when it can happen, maybe when you need to calm down and you start to understand, you give signals to the brain, or drink some drugs, yeah, take some drugs to decrease it, and the signals from the brain go to the heart too. Okay. Так, text. Yeah, we haven't time for discuss it deeply. Guys, please read it in the Saladin, okay? You hear me?
Yes.
Yeah, the important thing from this slide is sympathetic nerves raise heart rate, increase heart rate and contraction of strength, and dilates coronary arteries to increase myocardial blood flow. Okay, you know that dilatation of the cardiac arteries is also give more oxygen for the myocardial heart, yeah, for the heart muscle also. It's also important. It means that it's increase not only oxygen and blood level in the body, and also in the heart too. Yeah, because without the normal oxygen level in the heart can't contract fastly too. We need oxygen. And cardiac nerves carry not only sympathetic efferent fibers, yeah, but also sensory afferent fibers from the heart to the CNS, central nervous system. Do you understand afferent fibers, what means? Guys?
No, teacher.
Efferent fibers that goes from the brain to the some organs or for tissue, from the brain to the organ. For example, these signals that we discussed before, yes, they goes from the cardiac center, goes down to the heart, to the CA node, and our CA node start to beat faster. This is efferent fibers. But afferent fibers that goes from the heart to the brain. For example, if you feel pain, okay, this afferent fibers, you feel pain in the heart, and this information goes through the afferent fibers back to the cardiac center, okay, through the afferent fibers. Efferent from the brain to the heart, afferent back, okay. Parasympathetic nerves, this important that slow heart rates. And parasympathetic nerves, this means vagus nerves. You need to memorize it, guys. Parasympathetic, it's vagus nerve. And parasympathetic stimulation reduces the heart rate. Heart rate is strongly influenced by both diffusion, but dominated by the vagus nerve. This is important to memorize, vagus nerve. Okay, and right vagus nerve lead to the sinoatrial node, and left one to the atrioventricular node. Okay, here also you can see vagus nerve. It's 10 cranial nerve pair. You will discuss it many times in the future when you discussed about the digestion system or mostly digestion system is vagus nerve. Here, now we can go, how exactly sympathetic postganglionic fibers work, how they exactly increase our heart beating. Here, they are adrenergic. It means adrenergic, adrenaline or noradrenaline, or another way is epinephrine, norepinephrine. They released by postganglionic fibers. Maybe you remember these pictures. Yeah, about when we learned the synapses, you saw these pictures before. And for example, this adrenergetic sympathetic fibers, they release epinephrine or norepinephrine, and they connected with here neurotransmitter receptors, norepinephrine connected with them, and they release cycloadenosine monophosphate here, and CAMP. They activate. They produce enzymes that open calcium, natrium, and other canals. Mostly for us, it's calcium canals, and this calcium admitted from extracellular fluid and activates sinoatrial node in the cardiomyocytes. That's how exactly our sinoatrial nodes start to produce more impulses, and more impulses means more heart beating. Okay. Here, now parasympathetic or vagus nerves, they are cholinergic. Okay, guys, remember, sympathetic is norepinephrine and epinephrine. They activate CMP, CMP activate calcium channels opening, and after that, we increase our heart beating. Here, this one, parasympathetic vagus nerve, they are cholinergic. It means they produce acetylcholine, and acetylcholine binds to muscarinic receptors, opens potassium gates, and this potassium leaves the cells, and they become hyperpolarized and fire less frequency. After that, our heart slows down. Okay, and these vagus nerves, they activate faster because you see acetylcholine that produced by these vagus nerves, they directly open potassium gates. If we compare with adrenergic, they need to activate CAMP, or only after that CAMP activates these channels, and channels open and increase calcium level. Okay, parasympathetic, they faster. You hear me, guys?
Yes, teacher.
And this is important. Without influence from the cardiac center, the heart has intrinsic natural firing rate 100 beats per minute. What it means? It means if our heart will work without the parasympathetic and sympathetic nerves, without the brain, only heart working, their natural normal heart beating is 100. It's too much for us, yes? For us, 100 beats per minute is tachycardia. It's and it means after sometimes maybe 1 month or maybe 2 weeks, our heart will be hypertrophied, and hypertrophy of the heart, it's not good condition. It's like a disease to the heart. they work so hard, they tired. After that, maybe some heart attack happened or something like this. Okay, it's 100 beats per minute. It's too high for us. This is why this vagus nerve, they important for us. You see, vagal tone. Vagal tone holds down this heart rate to 70-80 beats per minute at rest for norm. Without vagal tone, we have tachycardia. Understanding? That's why our vagus nerve is important for us. Steady background fire rate of the vagus nerve. Understanding? For example, if you cut your vagal nerve here during some operation, for example, we know that vagus nerve, they go from the heart or from the brain to the heart, go through the neck. If we imagine condition in which we do some operation in the neck and you cut vagus nerve, what happened? We have tachycardia. This patient have tachycardia every time. He need to treat it every time. It's you damaged his heart, means. Okay, it is why vagus nerve very important. You never cut it from during the surgery. It's dangerous for the person. You see, this is why vagus nerve is important here. Please memorize this information. Okay. Intrinsic natural firing rate is 100 beats per minute. Okay, next. Here. How much time we have? Okay, 20 minutes. So, because after this topic we have another. That's why I need to be faster. Cardiac center in the medulla receive input from the many sources and integrate it into decision to speed or slow the heart. That's what we discussed, yes, before. We know when we need to decrease it or slow down. And here we have sensory or emotional stimulus. For example, the first stimulus, medulla also receive its input from the muscle, joints, arteries, and brainstem. For example, when you start running, the signals from your muscle and joints go to the cardiac center and your heart beating will be increased. And this it's understanding, yes, I think that increasing heart beating, it means more oxygen to the muscles and to the joints. And after that, muscles can produce more energy and you can run, you're not tired. Understanding this, guys?
Yes.
Okay, next, arteries and brainstem. Also, we have proprioceptors in the muscles here. We discussed it before. We have baroreceptors. Bara means pressure, signal cardiac centers in the aorta and internal carotid arteries here. This is heart, aorta, pulmonary trunk. Here, this is right coronary, common carotid artery. This is external, this is internal carotid artery. And here in internal carotid artery, we have carotid sinus, it's baroreceptor. And also in the aortic arch, we have baroreceptors. Bara is mean pressure. When our pressure increased, these baroreceptors give signals to the cardiac center that we need to decrease our heart beating. Yeah, understanding this one? Why we need to high blood pressure, we need to decrease heart beating. It means decreasing of heart pressure also. Or opposite. For example, this baroreceptor, we have a decreasing blood pressure, and these baroreceptors give signal to the cardiac center. We need to increase our heart beating. We activate our sympathetic nerves reflex, sympathetic nerves, and heart beating will be increased, and blood pressure also increased too. For example, when you have hemorrhage, yes, your blood pressure decreased because your part of the blood leave your body, and we need to increase your blood pressure through the heart beating. Okay. Or we have also chemoreceptors. here in carotid body and in the aortic arch, aortic bodies. They also give signals about CO2 or oxygen and pH. Do you heard about the pH? Yes. Do you know when we have hypercapnia or elevated level of the CO2 in the blood, it means you need to you need more oxygen. It's mostly this chemoreceptors mostly connected with the respiratory center, yeah, because it's about they give signals to breathing. When your CO2 or you have increased, you have hypercapnia, you need to breathe more faster to elevate this CO2 from the body. You need more oxygen to the body, you breathe faster, and this CO2 level in the blood decreased. Okay, these chemoreceptors connected to the respiratory system mostly. For us now, we have more important bioreceptors because it's connected with vagus nerve and sympathetic nerve reflex directly. Так, here, the temporary treat tachycardia and restores the normally elastic sinus rhythm. Так, что это? Та-та-та, это, так, yeah. Propose a mechanism by which the treatment would be decreased. We haven't time for this, guys. It's understanding, it's easy question here. Or maybe we discuss it. Oh, okay, we discuss it. It's about the bioreceptor, parareflex. You see, the temporary treat tachycardia and restores the normal resting sinus rhythm. Physician may massage fascia and carotid artery near the angle of the mandible. Propose a mechanism by which this treatment would have the desired effect. Who can explain? What do you think, guys? Your ideas about this? It's connected with this picture. Who can predict, guys? Ideas?
Yeah, could you just repeat the question?
Read this question here. Ramil?
Maybe by massaging the carotid artery, it will activate bioreceptors.
Yeah, and what happens?
Treat tachycardia.
Yeah, it means you see these bioreceptors, they work to pressure. Yes, if it's located inside the vessel, inside the internal carotid artery. When your pressure increased, it pressed to the arterial wall. Yes, internal carotid artery wall, and bioreceptor activates, gives signals to the cardiac center, and vagus nerve activate and decrease our heart beating. But if it's the same if you press it outside, you see, you press it by your fingers, and you press these bioreceptors, and bioreceptor decides that pressure so high, and you need to decrease it. And again, it sends a signal to the cardiac center gives signal to the vagus nerve decrease our heart beating, and tachycardia will be treated. Understanding this?
Yes, teacher.
Okay, good. Very good. Так, next. Chemoreceptors about pH, CO2, oxygen levels. Так. Please read it, okay, in the book deeply. Here. Yeah, also we have chemicals effects to the heart. It's not only something in our body, yes, it's only something that we eat or taken from outside or something else. For example, we discussed about neurotransmitters. Yes, it's catecholamines like epinephrine or epinephrine. We have some of them in the sympathetic nerve system, yes, in the neuromuscular junctions or neurojunctions. They produce themselves epinephrine, but also we can use it like a drug. Yes, adrenaline. Maybe you see it in the movies when patients have heart attack. They say adrenaline, please, and after that, heart start to beat faster. This is how work epinephrine. Epinephrine, adrenaline, the same. Understanding this? Okay, catecholamines, epinephrine. When you give it to the patient, it's increased heart beating. Yeah, now after that, after this lecture, when you saw the movie and hear adrenaline, you understand how exactly it helps. Drugs that stimulate heart, nicotine stimulates catecholamine secretion. It means when someone smokes, he has tachycardia because catecholamines increase, catecholamine is epinephrine, and we know epinephrine is part of the sympathetic nervous system that's increased heart rate, yeah, positive chronotropic effect, and that's why we have tachycardia. Or thyroid hormone. Do you know, guys, thyroid gland? Yes. And thyroid hormones increase number of adrenergic receptors on the heart, and it's more responsive to the sympathetic stimulation. More receptors, it means faster. This epinephrine and catecholamine that will be produced by this nerve will be activate our heart faster, more receptors, yes? And that's why, for example, patients have a thyroid, higher level of thyroid hormone. One of the symptoms of this disease will be tachycardia. So much receptor, that's why heart beating increased. Or glucagon. Glucagon is alpha cell produced by alpha cells in the pancreatic islets, and this glucagon accelerates the heart by promoting CAMP production. Do you remember? We discussed it. Yes, catecholamines like norepinephrine, epinephrine, they activate CAMP production, and CAMP production, they open calcium channels. And the glucagon affect to the CAMP directly. Caffeine inhibits, caffeine in the tea, in coffee, or chocolate also inhibits CAMP breakdowns and prolong adrenergic effect. Okay, you see, one process, if you know this process, how exactly sympathetic nervous system work, yes, I repeat, norepinephrine or epinephrine produced by the nerves. These two catecholamines activate CAMP production. CAMP open calcium channel, and calcium channel, we know it's directly affect to the work of the muscle, yes, muscle cell. These things, these drugs affect to this process in different levels, but idea, the result is the same. Okay, increased heart rate. Understanding this?
So they're all increasing heart rate, teacher. Those drugs.
Again.
Those drugs. So those drugs like nicotine, thyroid hormone, glucagon, caffeine, they increase the heart rate.
Yes, increase heart rate.
Yeah. Okay.
Electrolytes. How exactly electrolytes affect to the heart beating or chronotropic effect? You remember this? Chrono is time. Potassium has greatest chronotropic effect. For example, hyperkalemia exceeds potassium in cardiocytes. Its myocardium lacks excitable, and heart rate slows and become irregular because potassium themselves is decreased. You remember here, parasympathetic vagus, how exactly vagus nerves work? Yes, we tell that acetylcholine binds with muscarinic receptors and open potassium gates. And this potassium leaves the cells, they become hyperpolarized and fire less frequently. This is why heart slow down. Do you remember this? And now if you back here, you can see hyperkalemia, hyperkalemia, excess potassium is understanding, yes, how that's it's slow down our heart. After that, and hypokalemia, deficiency of the potassium with cardiocyte cells, they are hyperpolarized and require increased stimulation. Opposite. Now, calcium, hyperkalemia, excess calcium is decreased heart rate and contraction strength. Hypocalcemia deficiency, increased heart rate and contraction strength. Что-то неправильно. It's opposite. It's this. I think it's mistake. Why so? Так, wait. Что это? Just a minute. Maybe mistake in the presentation. No, it's normal. Так, here. Where is my? How I need to open it? You see my screen?
Yes.
Teacher.
Так, next. We haven't time so fast. Okay. The other factors. Okay. Now we finished. Yeah. I shortly explain you again. Explain you this part. Так, we discussed that cardiac output. Yes, we understand what it means. Connect with the heart rate and stroke volume. Heart rate is chronotropic effect. Yes, positive or negative. Positive means increase heart beating. Negative is decrease heart beating. Okay, and positive connected with the sympathetic nerve system with epinephrine or epinephrine, and parasympathetic nerve system with the vagus nerve. Okay, parasympathetic slow heart rate. We understand how exactly they work with calcium and potassium hits, and we discussed about the proprioceptors in the muscle and joints, bioreceptors that located in the vessels, and how exactly they can affect to the heart rate. And also we discussed about chemoreceptors and about some chemicals effects, yes, about the drugs which can also have chronotropic effect. Okay, electrolytes and etc. Understanding this part of the topic. Guys, if you understand something, when you read it themselves, you understand totally. Okay, because when you read themselves, you understand something when maybe you don't understand during the lecture, and also it's new information for you. You can't understand everything. That's why it's hard, but you should listen lecture. Understanding? Guys, yeah. To be honest, for example, your knowledge, it's 100%. When you listen lecture, you understand 20 or 30, maybe 20, 30, 25% of the information. You understand, oh, we have, okay, cardiac output, something about something epinephrine, okay, maybe here, preload, and etc. When you read themselves, the topic in the book, you understand 50%. And when you discuss it in the lesson again after that, you understand everything, because something maybe you leave, something you don't understand, but after discussion you understand it totally, and you have 100% of knowledge. After that, when you go to the exams, you need only 5-10 minutes to check some notes, and you memorize everything. This is how it works. If you don't listen lecture, you understand only 75% of the materials. Or if you hear listen lecture and discuss it in the lesson, but you don't read themselves, you have only 50% of the topic. Understanding it? Understanding this idea?
Yes.
Yeah, that's why you must do all these three things. It's important for you. It will be easier to go to the exams. And to be honest, guys, these topics, I can tell you from my experience themselves, these topics, you read only here in the first year on the medical school. After 3 years, no one discuss it with you. It's understanding that you should know it. But it's important to understand pharmacology, yeah, drugs effect. Without understanding how exactly sympathetic, parasympathetic system work, you never understand why we give the patient beta blockers. Why beta blockers, these drugs, the most abundant drug, decrease heart rate. Why you give it? Because, where is it? Here. Because beta adrenergic fibers activate our CAMP, and if you block these receptors, CAMP will never produce and heart rate never increased. Okay, this is one of the way how to decrease blood pressure, to block these beta adrenergic fibers. If you don't know the normal physiology, how it's working, you never understand how drugs work. And it means if you don't understand how drugs work, you never understand how to treat patient. And it means you are not doctor. Yeah? If you don't understand how it works, how to treat patient. This is why you need to understand physiology, normal physiology, how it's working for understanding in the future pathophysiology. It's abnormal conditions. Okay? Yes, Ramil?
Teacher, so is this correct? You discussed about the calcium excess and calcium deficiency.
Yeah, it's correct. It was from Saladin, I checked.
Okay. But I thought it should be like vice versa.
Yeah, I thought it before, but I checked it. It's it means because of contraction strength, it means heart can't, it's how to explain it. I don't know how to explain it in English. It means your heart, if exceeds hypercalcium, it means exceeds contraction, okay? And do you remember we need to, for each contraction, we muscle need to contract and relax. Relax is a part of the contraction, we need it.
Yes,
but
teacher.
Excess hypercalcemia, it's produced, don't give this muscle to relax. This is why, this is why next contraction never happen. And during the hypercalcemia, patient can die in the contraction. If the muscle can't relax, this is why it's decreased a heart rate. Or hypocalcemia, it's understanding, it's increased because we have deficiency of the calcium and muscle can contract. Okay?
Okay. It's like the kind of same principle, alike with skeletal muscles, teacher, the cardiac muscle.
Again?
It's kind of like has a same working principle, yes, teacher? With,
yeah, all muscles contract the same. It doesn't matter, straight muscles, cardiac muscles, they all of them, or smooth muscle, all of them need calcium. And they need to relax after construction. Do you remember the ECG? Yeah, ECG, we have contraction. After that, we need relaxation to prepare it to the next contraction. Without relaxation, no contraction. Okay.
Okay, teacher, I understood.
Okay, good. Oh, next part we have. Oh, we need to be faster. Okay, next part we need to discuss about the stroke volume. Yeah, the second part of the cardiac output is stroke volume. And stroke volume, it have variables of three things: preload, contractility, and afterload. Yeah, here examples: increased preload or contractility cause increased stroke volume. Increased afterload cause decreased stroke volume. Oh, easy words. Preload, it's before level of the blood that go to the heart before the contraction. No, here we have, yeah. Slide. Preload, the amount of tension in ventricular myocardium immediately before it begins to contract. It means we have elastic. Here we have heart. Ding, ding. It's my heart, okay. Here we have vena cava inferior, superior, vena cava inferior. Here we have aorta. Okay. Now here pulmonary tract. It doesn't matter. Preload is the amount of tension in ventricle myocardium immediately before it begins to contract. It means our ventricle here increased, delayed, and this tension in this wall, it's preload. how to say easier. For example, blood go to the heart due to these veins. Yes, it will be, for example, 40 milliliter. I don't remember. I don't know exactly how much it's. For example, yeah, okay, 40 milliliters go to the ventricle. It's increased, the delayed, and this tension dilated ventricle. It means increased tension in the myocardium, and this tension it means preload. It is connected with the volume that go to the heart, okay, to the ventricle here. For example, if it will be only 20, it's not enough. It's decreased preload. If it will be 60 milliliter that goes here, it will be increased preload. It means tension in the ventricle myocardium increased so much. It's and preload increased preload. It means more harder heart, more work to the heart. It's also not good. Okay, we discussed it next slides. What increased preload caused? Yeah, increased force of contraction, exercise, increased venous return, and stretch myocardium. This it happened because it's connected with here. More blood go to the heart, it increased preload. More, yeah. And during the exercise, we have more heart beating and more blood faster goes to the heart. For example, because of the muscles in the legs. It's not understanding for you now, but after some lessons, I would explain it again when we discussed about the venous return. Cardiocytes generate more tension during the contraction, and increased cardiac output much increased venous return. It's not understanding, yes? Guys, do you understand?
Teacher.
Yeah, it's not understanding. Okay, easier. It's connected with the blood goes, volume of the blood goes to this ventricle. How much this volume will be, how much this ventricle will be delayed. It means more tension. It's in his wall. For example, do you remember when we discussed about the muscles, straight muscles in here, for example, biceps? Yeah, but they never have the function that, по-моему, где-то здесь было. Нет? Straight load. Так, just a second, maybe I have some. I don't remember this word. No, так.
Which word, teacher?
Okay, I explain it another way. For example, when you have, when your biceps will be, как рассказать-то?
You mean like contracting?
Yeah, it's connected with the contraction. For example, our heart can contract also when it delayed. Okay, it's if it delayed much, it also contracts faster. Okay, it's one of the function of the heart, cardiomyocyte. You must go back to the function of the cardiomyocyte and read about his function. That's why increased venous return, stretch myocardium. It means increased dilatation, dilatation of the myocardial It's also help to contract them. Okay, it's complicated, but guys, please read it. When you read it in Saladin, you understand. They explain it another word. I can't remember these words. And also we haven't time for it. We need to discuss a second topic too. Please read it, okay? About the first part of the topic was easier than this one. You need to read it themselves too. And also about the Frank-Starling law of the heart. It's stroke volume connected proportional to the end diastolic volume. It means, for example, here we have example. For example, if the right ventricle begins to pump, and I know it's not the thing. The more they stretch, here, you see, the more they stretch, the harder they contract. Yeah, here, this is idea. Okay, it means more if our right ventricle stretched more, for example, 60, yes, milliliter will go to the ventricle, and his walls will be stretched more, and it's harder contract after that. Understanding? Please read it about this more detail. But this is connected. This is Frank-Starling law. It's important for the preload. And after that, you understand it. And here, for example, also they give you example. If the right ventricle begins to pump an increased amount of blood, this soon arrives at the left ventricle and stretch it more than before, and causes it to increase its stroke volume and match that of the right. Okay, it's about connected with the volume and stretch. For more totally understanding, I know it's hard. You need to read it themselves too. Okay, guys?
Okay, teacher.
Так. Contractility refers to how hard the myocardium contracts for a given preload. You see, this is important. It doesn't describe contractility. Is the second thing that connected with the stroke volume. And it doesn't describe the increase in tension produced by stretching in the muscle. This is increased tension produced by stretching in the muscle. It's about preload. Yes, stretching in the muscle is when it happened when our ventricle delayed, when blood goes inside. Yes, it's understanding how much blood comes to the ventricle. It stretches the muscle. It's also increased the tension. This is preload. But contractility increase caused by the factors that make the cardiomyocytes more response to stimulation. Contractility discussed about the factors which affect these stimulations. For example, inotropic. Before we discussed the chronotropic, about the time. What in the chat? When a lot of blood enters the heart, the myocardium gets stretched, and this causes the cardiomyocyte to gain attention, the contraction further. Yes, 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 yes. And more blood will get expelled. Yeah, you understand right. Here, we discussed about the chronotropic effect. Yes, chrono, again, it's time. Inotropic, it's about the fiber changing. And positive inotropic effect and negative again. Positive inotropic agents increase contractility. Negative inotropic agents decrease contractility. For example, calcium has a strong positive inotropic effect. And I think it's understanding, yes, because more calcium, more ability to contract, because calcium needs to contraction in the muscle. But calcium imbalance affect not only to the heart rate, and also contraction of the strands. And hypercalcemia can cause a strong prolonged contraction. What here you see, we discussed before, even cardiac arrest in systole. You see why this? And if we have arrest of the systole or prolonged contraction, it means no heart beating. You see, we discussed it contracts but not relaxed. If it not relaxed, we don't have another contraction, no another heart beating. It stay in one contraction and don't relax, don't produce another one. That's why it's hard. Hypercalcemia is also emergency situation. Okay, guys, do you understand the differences, contractions with before discussing things? Agents that affect calcium availability, it's catecholamines, increase calcium levels, glucagon, stimulates CAMP production. We remember this, CAMP production activate calcium channels, and calcium channels open and increased calcium level inside the cell. And digitalis raises from the plants, yes. raises intracellular calcium level and contraction strength. Here, negative inotropic agents reduce contractility. Hypocalcemia, it's again, I think, understanding, yes, because without calcium normal calcium level, we can't contract. That's why contractility will be decreased. Hyperkalemia, it's also understand, yes, if you remembered how exactly potassium work, it's also connected with the vagus nerve, for example, that through acetylcholine open potassium channels increase calcium potassium level in the cell, and it's reduced myocardial action potential. That's why, yes, and they release calcium into the sarcoplasm. That's why contractility will be reduced. And also themselves vagus nerve effect on the atria through to the ventricles for a significant effect. Okay. And the last one is afterload. Afterload, the blood pressure in the aorta and pulmonary trunk immediately distal to the semilunar valves. It opposes the opening of the valves and limits stroke volume. It means, you see, it's pressure inside the aorta, its pulmonary tract. If we need to, when our heart contracts, we have opposite pressure. If this pressure in the aorta and pulmonary tract will be higher, it means it will be a problem for the heart contraction. I hope you understand it, yes? That's why afterglow have negative effect to the stroke volume. It's limited because it's opposite pressure to the heart. Now hypertension increased after load. Yeah, hypertension increased after load and opposes ventricle ejection. Hypertension is condition when we have higher blood pressure, yes, in the body, in the whole vessel. It means we have high blood pressure in the aorta and pulmonary tract too, and it's limit heart or stroke volume. You see, understanding this, guys?
Yes.
And anything that impedes arterial circulation can also increase afterload. Lungs disease, for example, restrict pulmonary circulation, or it's called cor pulmonary. For example, when we're talking about the aorta, it's body pressure, yes, high hypertension, for example. If we talk about pulmonary tract, it's hypertension in the lungs. And it means it will be limits its opposite pressure to the right ventricle. This is why we have cor pulmonary. It's lung diseases, some that will be increased blood pressure in the pulmonary trunk. It's increased afterload. You see, afterload will be connected with the lungs or with the body themselves. Do you learn before? I don't remember about the pulmonary circuit and body circuit. Do you know differences between these circuits?
Yes, teacher. So pulmonary circulation, it's the blood goes to the lungs and goes back to the heart. And in the normal, assisted body, from its blood flow from heart to the other tissues, and from other body tissues come back to the heart.
Yeah, due to it start from the pulmonary circuit, it start from the right ventricle and go to the left atrium, yes, through after the lungs. Yes. And oxygenated blood goes to the left atrium. From the left atrium, it goes to the left ventricle, and from the left ventricle, due to aorta, all oxygenated blood goes to the whole body and back to the heart due to veins. Yes, vena superior and vena cava inferior go to the right atrium. And it goes back, yes, again, right atrium to the right ventricle, again the pulmonary trunk, through the pulmonary trunk to the lungs, and again. Yes, two circuits. It's understanding. That's why these two vessels important. Okay, что это? Proprioceptors, signal cardiac, yeah. Here about the proper receptor signal cardiac center that begins, it begins with the exercise, signals from the joint, we discussed it before, increase heart rate, and etc. etc. Here, this task. Suppose a person has a heart rate 70 beats per minute and stroke volume 70 milliliters. Negative inotropic agent then reduce the stroke volume to 50 milliliters. What would the new heart rate that to maintain the same cardiac output? What do you think, guys? Do you have ideas about this? Guys?
I think because he's relaxing.
We need to count it. We need to count. Do you remember cardiac output? I will open you
the pulse multiplied by
here.
volume.
Here it's 70. This one 70, and this one 70. After that, after negative inotropic effect stroke volume, it's 50. And they ask you how much heart rate should be to the same cardiac output. You need
More
to count.
20.
How much?
More 20.
20.
More.
90, 80.
How you count? Here.
Randomly.
Here you see, in the initial state, the formula cardiac output is heartbeat multiplied to the stroke volume. Your heartbeat here is 70. Here it's stroke volume, sorry. This is stroke volume, 70 milliliter, and 70 beats per minute, your heart rate. So stroke volume multiplied to the heartbeat, it's 4.900 milliliters per minute. It is cardiac output. It means this person exhale, his heart exhale 5 liter per 1 minute. And to maintain, you understand now? To maintain this volume, we need to,
Yes. So I did it exactly the same way, teacher.
You see me? You hear me? Or something happened with the Zoom? And here you see this 490. We need to, how in English, this one. And we have 98 beats per minute. Okay, it's for understanding how they connected. Do you remember after that when we discussed why, for example, male have decreased heart rate because his stroke volume higher? This, for example, for it can be male, this can be woman, for example, but it's not. It's tachycardia. This women have less volume in the heart because of little heart. Yes, it will be 50. Male have 70, and he needs only 70 beats for give this cardiac output. But for women with little heart, we need more heart beating for the same cardiac output. Understanding? Yes, Sad?
Ma'am, I saw. I remember I watched a documentary movie that about someone who can decrease their heartbeat till I think 6 beats per minute or something like that.
Maybe due to meditation. It can be happen because we remembered, yes, we discussed about cardiac center, and so many things can affect the cardiac center to control our heart beating. Maybe they have some meditation or something like this and can give signals to this cardiac center to decrease blood pressure due to vagus nerve. I don't know, maybe they can because meditation is also help. if it's the main power, okay? If you relax, you can give signals, and also you calm down because of your brain. It can happen. Maybe they do the same.
Okay. Does that affect on long time or long term?
What?
Does that affect for long term? That affect positively or negatively on the heart for long term?
I think it's not good, because the heart after that, if you see, if your heart beating decrease, it means your heart stroke volume should be increased, and it will increase only if your heart will be bigger. It's hypertrophy, it's bad condition, it's disease for the heart.
Mm-hmm.
Why it's not good to it's normal level, it's normal. Okay. Next, we need fast. This picture is taken from the Saladin. You can open it too. It's positive chronotropic agents, negative, positive inotropic agents, and negative chronotropic, negative inotropic effects that increase and reduce heart working. Okay, you can open it. Because we have only 40 minutes for the second topic, I go fastly. Coronary artery disease. I fastly show you my ideas. This is atherosclerosis. Maybe you heard about this. Atherosclerosis, it's when some lipids will be affect our hair. For example, this is lumen of the vessel. This is lipids. How exactly it happened? Please read it in Saladin. When this plaque or close, it can close lumen. You see, for example, it's healthy artery. These lipids will start to affect the medial intima here, this one, and after that it can close. You see, 50%, for example, of the lumen, or for example, complicated plaques with calcification. It can close the vessel. Here, thrombosis can happen. It's very big disease. For example, plaque rupture. If this plaque will rupture, these small pieces can go to the small arteries in our eyes, for example, or in our finger, in the leg, or in the arm. Or maybe also, you know that in the heart we have only two big arteries, yes, right and left coronary arteries, and so many small one. Or maybe in the brain we have the small diameter vessels, and if you imagine this rupture go to the small arteries, they close them, and we have stroke in the brain, infarction in the heart, or maybe blinding because of closing some arteries in the eyes, for example. Understanding why it's a dangerous condition, atherosclerosis. And it also can close this vessel themselves. You see here, blood clot form limiting blood flow here, and it's calling ischemia. Ischemia of the leg or organ. It depends on where exactly this vessel closed. Understanding? Guys, please tell me, because
yes.
I can't understand it, but how exactly they are formed, those lipids in the vessels?
You should read Saladin, because I want to explain you, but we haven't time. We have only 40 minutes for explain the second topic. Second topic is bigger. This is why I don't know why I haven't time for this. Yeah, we have 35 minutes. It's interesting, but please read it. Maybe if next two lecture, if we have time, please ask me again and we discuss it more detail, okay? If you don't understand. Or also you can discuss it with your teacher in the lessons. Here I want to show you only this, my ideas. This also atherosclerosis is disease where what exactly I treated in my practical practitioner. Yes, here atherosclerosis, cardiovascular disease. You see, this is thrombosis. This is atheroma. Atheroma close the lumen of the vessel, and it can be caused to thrombosis. If you remember the blood, how exactly clotting happened, mainly the factors, and one of the factors is decrease in blood flow. And thrombocytes start to stick to each other. It's how thrombosis happened. Do you remember the all factors for thrombosis? You read about this in the blood topic. And here you see, if we have this atherosclerotic atheroma in the internal carotid artery, is the risk for ischemia or cerebral infarction, like this one. If it's located in the carotid artery, it will be infarction. If it's located in the renal artery, it will be renal ischemia. Or if it's located in the leg, for example, in tibial artery, it will be intermittent claudication. It means patients feel pain every time when he walks, maybe 10 meters or after 50 meters, or maybe he lay down, but this vessel so closed and he feel pain because, you know, yes, pain when we have infarction. If you remember how exactly pain, why you feel pain in the heart attack, in the, for example, intermediate claudication, if you remember, if a level of oxygen decreased, it's ischemia of the tissue, and some lactate, you remember, produced, or other some ferments, and these ferments affect nerve, and nerve gives signals, afferent signal to the brain about the pain. This is how it's working. Understanding? We haven't afferent nerves inside the vessel. You never feel where exactly atheroma happened in your body. You feel only the pain if your tissue will be damaged, not some process in the vessel. Why is this? Why atherosclerosis is dangerous? Before some diseases, you never know about atherosclerosis. Ramil, can you tell me, yeah, right now, not write in the chat because we haven't time to read it. Can you ask me what you told him in the chat?
I just give information about, send information about atherosclerosis, teacher.
It's for other students if you want to read, or after that, I know this themselves, guys. We just haven't time to open it. Treatment, yeah, coronary bypass surgery, balloon angioplasty, and laser angioplasty. I want to show you it. I want to show my, where is it? Here. Oh, как это открыть? Sorry, where, how to open it? This one. Do you see it?
Yes.
YouTube?
Yes.
Yeah. Here, this one. This is angiography. It means we give some contrast to the vessel to see how exactly it look like by the röntgen X-ray. For example, we punctuate the femoral artery. Here. Now we can go to the heart due to aorta, and doesn't need here. We give contrast. This one. Here, it's X-ray view. You see, we give contrast, and now we can see where is the problem. Here, we have atheroma, that close lumen of, here, blockage, close lumen of the artery. We check the right coronary artery, it's normal, left one have blockage. The second one. Or another way is go to the radial artery.
A needle.
Here, we can punctuate here, radial artery. And again, we can go to the heart. This one. Do you see my screen?
Yes.
Here.
It's again X-ray view, and we give contrast. Where is contrast? Here you see left coronary artery, right one. And again, we can see blockage here. This is atheroma. Here. And one of the treatment is balloonoplastic. We have balloon. We need to
Expand it.
Yeah, we can expand it. Yeah, balloon inflated and pressed atheroma. You see here. But this is not good because it can again restenosis. Again, the lumen will be closed by another atheroma. That's why we use stents. You see stent? If we leave stent here, it's less risk that this stenosis happened again. You see? And now we can go. This stent will open this lumen to the rest. Okay, next one. It's a coronary artery bypass graft. Here. This one. In coronary artery bypass graft, we use section of the great saphenous artery vein. Theta. Here, this one. This is great saphenous vein in the leg. We can use section of them, or maybe small artery, thoracic artery here, and we use them to bypass some region, some vessels in the heart. But here it's important that we need to heart lung machine, like this one, because we need to connect our vessels, great vessels, with heart lung machine, and this machine will be work during this operation. We'll here, yeah, the sternotomy, how exactly we do operation. Yeah, we cut our heart. After that, we connect it with our vessels with the heart lung machine. Here, you see, heart not beating because this machine working. And now we can heart stop and we can operate it. This is the section of the great saphenous vein, for example, and we do our bypass. That's why, because maybe this artery was closed by atherosclerosis or something like this, and we do bypass operation and close it again. Okay. Oh, stop. Now we need to fast. We have 30 minutes to go to the second topic. Second topic, it's about the vessels directly. Where is my lesson? Here. Do you see my screen? Do you see PPT?
No, teacher, no.
No, doctor.
Another way we need to do it. Hard, not hard, this one. Now?
Yes, doctor.
Okay. The second topic about the vessels directly, and we have 25 minutes for this. But to be honest, it's anatomy. It's easy to understand if you read the topic themselves. Here. Okay, go. After this lesson, you describe the structures of the blood vessels, you understand the types, arteries, capillaries, veins, why they different, and also some variations of the route, and etc. Okay, now this is another. I think you have a lecture about histology lecture, yes, about the vessels.
Yes,
Yes,
teacher.
doctor.
And you know the differences, yes, arteries, vein, capillaries, histology, like this one, how they differ. This is artery, this is vein, and this is nerve. I think you understand. If you know histology, you know different. Why it's look. If you see to the artery, it's open, lumen open, but vein, it's closed. It's connected with the structure because in artery we have elasticity tissue and more of vein, more muscles here. Okay, arteries carry blood away from the heart. Veins carry blood back to the heart. It's important. It's the name not connected with the oxygen level, you see? We never say that arteries, the vessels that have more oxygen or veins have less oxygen because it's not correct. Arteries is all vessels that efferent vessels, yes, goes from the heart. It's also efferent, the same name. You remember we discussed before? Veins, it's afferent. They take blood back to the heart. Because if you remember, yes, two circuits, we know that pulmonary trunk, it's artery, and it goes from the heart, but have deoxygenated blood, yes? Do you remember?
Yes.
Yes, teacher, to the lungs.
Yeah, to the lungs, and veins go to the heart, but they have oxygenated blood. That's why these terms are important. Okay. We have histological structure. We have tunics, 3 tunics. Tunica interna, tunica intima, lines the blood vessels and it exposes the blood. I will not explain everything. You will read it themselves, but we should know that endothelium, simple squamous epithelium in the vessels, and endothelium is like a prolongation of the endocard. You remember, in the heart we have the inner layer, and it will be like a prolongation of this heart layer inside the vessels. Так, this one. Tunica, you read everything about the more detailed themselves because we haven't time again. Tunica media, mostly it's smooth muscle. It's smooth muscle, collagen, and elastic tissue. It depends on the type of the vessel, but mostly it's smooth muscle. It's the middle tunica inside the vessel, and we have the motion, changes in diameter of the blood vessel brought about the smooth muscle because of this tunica media. If you have tunica media, this vessel can contract. For example, capillaries absent of tunica media, capillaries can contract. Tunica externa or adventitia is outermost layer and consists of connective tissue that often merges with the neighbors blood vessels, nerves, and other organs. And here, important to know about vasa vasorum. Vasa vasorum is small vessels that supply blood to the outer half of the larger vessel. For example, here, if we discussed about capillaries, we're absent of vasa vasorum because here in capillaries we have only tunica interna with endothelium and basal membrane. Here, you see, it's only tunica internum, only one level. Here, all types of the veins and arteries, they have 3 layers, interna, media, and externa, but they different. But if you imagine, for example, for capillaries, we doesn't need vasa vasorum. Capillaries, you understand that, guys, endothelium, it's also tissue, yes? And all tissue, all cells need oxygen. And capillary tissue, endothelium, can take this oxygen directly from the bloodstream because the diameter is small and some nutrition and oxygen, we take it directly from the blood. But when we talk about the arterial, venous, and distributing or conducting artery and big veins, for example, the tunica of them, yes, wall of these vessels, they are thicker. And for example, tunica externa need oxygen too, but it can't take oxygen directly from the lumen. This is why we have vasa vasorum. It's small vessels that give nutrition for tunica media and tunica externa. Understanding? Vasa vasorum is vessels of the vessels. Understand?
Yes, teacher.
Okay. Next, it's important, you must know it. The teachers during the lesson ask you about this. Here, we're back to this picture again. Yeah, this is circuit. Okay. Here, arteries. About the arteries. Arteries are sometimes called resistance vessel because they have relatively strong, resilient tissue structures that resist high blood pressure. It's important. This is why we have elastic tissue inside, mostly in the conducting large arteries, biggest arteries. For example, here, aorta, all aorta, from the arch to the abdominal aorta. You remembered, yes, aorta have, aortic arch have descending, part, descending aortic arch directly and ascending, sorry, aortic arch and descending part. Descending part separate for two by diaphragm, thoracic part of the aorta and abdominal part of the aorta. You discuss it more detail in the anatomy vessels, but you should know. And all aorta and common iliac artery, subclavian arteries, and common carotid arteries, and also here pulmonary trunk, the biggest arteries of the body, and they are conductive. And here conducting, and here they have you see tunica media, where is it? Have a layer of elastic tissue, internal elastic lamina and external elastic lamina. This is middle tunica media, very strong because we need, because of pressure of the heart. For example, if we have here thinner tunica media, the wall will be damaged by pressure, because you imagine, yes, pressure for 60, 70 beats per minute. It means high pressure every time, every second to this wall. They need to be thick and strong to compare pressure in the same level. That's why this conducting elastic or elastic large arteries have very thick tunica media. Next, distributing medial arteries. Here, they have very good internal elastic lamina and external elastic lamina between the three layers, and they have some openings. For what, guys? How you think? Why we need these openings?
Maybe for these arteries and like small vessels.
Yeah, you're right. For the vasa vasorum, we need this opening. For the vasa vasorum. Okay. And this distributing medium artery is all artery in the body. For example, renal artery, femoral artery, radial artery, or some coronary arteries, all arteries, yes, internal carotid, and all arteries that have names in the body, mesenteric artery, they are distributing. And the last one, small arteries, resistance. They haven't internal elastic lamina, you see, here and here, for example. They have only endothelium, basal membrane, tunica media with muscles, and external. They have thicker tunica media because they contract. Do you remember when our blood pressure changed? Our arteries contract because of this tunica media in the resistant small artery. And also diameter depends of how much muscle cells we have in the tunica media. In the Saladin, they give you numbers. For example, we have big arteriole and the smallest one near the capillaries. that consists of only one or two muscle cells here in the tunica media. Okay, diameter connected with the tunica media counting here. And metarterioles. Metarterioles, it's short vessels that link arterioles and capillaries to capillaries. And mostly they located in the mesentericum, digestive tract. When you discuss about digestive tract, metarterioles very important. Here. Aneurysma. Maybe you heard about the aneurysma. I'm so fast because guys we have so much or a little time, only 10 minutes. Okay. Do you understand something about an arteries?
We understood, yeah.
Yeah, I hope you understand that the arteries have three types, and it connected with the lawyers. Okay. More detail you read themselves. Aneurysma. Aneurysma is the weak point in the artery or in the heart. For example, when I tell you about the conducting elastic large arteries, I tell you about the elastic tissue. It's important because it's recoil during the diastole and give us no normal blood pressure. And here, if something happened with the wall, we have enlargement of this vessel. Enlargement of the vessel. It's aneurysma. It's not normal condition. It's because something, maybe wall was ruptured, or it's some elastic tissue was ruptured, and it happened that enlargement of the artery. Never to say that aneurysma happened only in the heart or in the arteries. If you talk about the enlargement of the vein, it's varicosity. Okay. For example, aneurysma of the vein is not correct, or varicosity of the artery is not correct. Enlargement of the arteries, it's aneurysma. Enlargement of the veins, it's varicosity. Okay, guys.
Okay.
Yes.
Так. Blin, we haven't time. You should read about arterial sense organs. Carotid, we discussed, yes, about it. Carotid sinus, carotid bodies, aortic bodies. We discussed in the first part of the topic about bioreceptors, chemoreceptors. It's again in this topic we'll discuss. Here, capillaries. Capillaries have only tunica internal, yes, have only endothelium and basal membrane, basement membrane. But capillaries themselves have three types. It's connected with a function, and it's connected with the structure of this basement membrane. For example, we have continuous capillaries, fenestrated capillaries, and sinusoid. Continuous capillaries occurs everywhere in the body. All capillaries, simple capillaries that you know, it's continuous capillaries. Fenestrated capillaries located in the kidney, small intestine. It's connected with the function. They fenestrated, it's connected with the name. You see, they have some openings that help to diffuse some nutrition, absorb nutrition faster, or filtration in the kidney. Filtration in the kidney and absorption of the nutrition in the small intestine. That's why they call fenestrated. And sinusoid, discontinuous capillaries in the liver and bone marrow and spleen. I think you read about the bone marrow and spleen function before, about the blood topic. Yes, you know the function of the liver also. And here, for example, this is sinusoid in the liver. And these capillaries look differently. For example, with fenestrated have some openings here for filtration, and this can the same simple continuous capillaries. But continuous capillaries have special cells. You should know about this. Pericyte. This pericyte have, you see something pink, it's muscle tissue, not muscles themselves, some muscle fibers. And these muscle fibers in pericyte can contract this capillary. You see, we haven't muscle layer, but we have muscle fibers inside the parasite that can contract the capillaries. Okay, this is also important. You must know the teacher will ask you about the pericytes too and their function, as also pericytes help to in regeneration process of capillaries. And of course, you should know about the junctions and everything of this more detailed structure. You should read it themselves. Here, capillary beds. Capillary beds, it's like a sphincters. You remembered we discussed that in capillaries we haven't muscle. The muscle that can contract the whole capillaries. These cells, it's like not give total contraction of the capillaries like in the arteries or in the veins. It's this small contraction, you can say, but most important that contractions that can close vessel, it's in capillary beds. It's like sphincters, you see. These capillary beds, sphincters opens, for example, here, and it's closed. The small, easy situation. For example, guys, you hear me?
Yes,
Yes,
teacher.
teacher.
These capillary beds mostly located in the intestine and in the muscles. For example, when you rest, you are sitting right now, all these capillary beds, and you're not eating something, all capillary beds in your body, in the intestine, in the muscle, they closed. And all your blood located in your great vessels, here in arterial, in veins, not in the capillaries, because you don't need excess oxygen in the muscle. You don't running, you don't do exercise, you're just sitting, or you don't eat something. That's why they closed. Or for example, after the lecture, you go and eat something and you need to more oxygen for your intestine, yes, to absorb some nutrition, to activate your intestine, to secrete something. And we know not one process that can happen without oxygen. It means more oxygen, more blood should go to the intestine. That's why your capillary beds in intestine will open. And maybe you saw before, when you eat something, after that, you feel you want to sleep. Do you remember the situation? You eat, after eating, you want to sleep.
Yes, teacher.
And sometimes some of the people laughing that all blood goes from the brain to the intestine. It's true, because most part of the blood, yeah, that was normally in the brain, for example, in the arm, they go to the intestine to do digestive process. And that's why you feel some limited, decreased oxygen in the brain. But if you start to, if you want to wake up, yes, you need to just stand up and walk somewhere, some 5 minutes maybe, and you wake up, because these capillary beds here start to close, and some part of the oxygen, some capillary beds in the muscle start open too, because you need, and it means oxygen, blood start to go to another region of the brain or of the body. Sorry, guys. Okay, this process is it depends on the function of the body, what you do. If you read more detail, you understand, but the function of connected with the location of them. Okay, or but you should know, if all capillary beds in our body opens in one time, you can die, because all blood goes from the brain, from the kidney, liver, inside to these capillary beds, and all these 4-5 liters of blood go to these capillary beds, and our periphery, like brain, heart will be without oxygen. That's why these capillary beds, mostly they open or closed and open only when they need. For example, you need to run. Yeah, some emergency situation, you need to run. And capillary beds will be opened in the muscles, and you have power to run from somewhere. It's all of this process connected with the heart connection of these vessels, nerve system, and etc. If you read more detail, you understand. Okay. But you should know, yeah, but you should know that mostly they're located in the intestine and in the muscles. Так. Maybe most of the part of this topic you don't understand because I speak so fastly without details, but if you read yourself, you understand. It's easy topic, only anatomy here. More detail, more harder. And please, guys, read it very carefully because next topic of the lecture is capillary exchange. It will be more detailed. And we also discussed about something that I don't explain you right now. But if you have some question, I think in the lessons also the teachers explain it for you too. Venous sinuses, larger. We have veins, different part of the types of the veins also. Postcapillary venous, muscular venous, medium veins, venous sinuses, and large vein. We can back to this picture. Where is it? Here. Venous, medial vein, and large vein. And they also consist of three layers: intima, media, tunica, intima, media, and externa. But you should know that veins never have elastic tissue. The tunica media consists only with muscle. And these muscles, the large diameter of these veins can connect with how much cells we have, how much layers we have in tunica media. Okay, and if you read, you understand. Next. And also venous sinuses, we saw they different here in the liver, venous sinuses. This one, more interesting thing that I want to tell you, it's varicose of the vein. I said it before, enlargement of the arteries is our aneurysma. Enlargement on varicose, it's vein, enlargement of the vein is varicose. Varicose disease, I think you saw it before, like this one. Maybe your some friend, someone, maybe mother have this disease. Do you see it before? Varicose of the vein?
Yes, teacher, I've seen it before.
Yeah, here this because our medium veins, they have venous walls like this one in this picture, and these venous walls prevent regurgitation of the blood in these veins, because we know, yes, blood in the veins go to the heart. And it's harder. This without the walls, it will be every time regurgitate, yes, because of direction. It go up, it's harder, and that's why we need these walls. And varicose of the veins, it's a problem with these walls. They can't close every time we have regurgitation. That's why veins will be have this view. Varicosity, they have enlargement because of regurgitation of the blood in these veins. We back to this in the next person. When we discussed about the venous return, but the main thing why this varicose disease is dangerous. When we have the varicose of the vein, it's superficial vein, guys. We have two types of the vein, deep and superficial. Deep you can see because they're located inside the muscle. But these veins that you see in varicose disease, it's superficial veins. And only 10% of the blood back due to these veins, superficial veins. 90% of the blood go back to the heart due to deep veins. Okay, memorize it because no one except me, because I am a vascular surgeon, know this information, and also in Saladin they don't give this information for you. Only 10% of the superficial blood back through the superficial vein. And when patient have varicosity of the vein, it means these veins don't produce their function themselves. That's why we can do operation and take this vein out from the body. For example, phlebotomy. We take it away because this vein don't produce this, don't work. It doesn't need to our body. But for example, you also sometimes you don't need operation, but you still have risk of thrombosis of this vein. If thrombosis happen, or in the deep vein, the thrombosis happen, we have one emergency complication, pulmonary embolism. You see, we know that all blood from the veins go to the right atrium, and from the right atrium to the lungs, yes, to the pulmonary trunk and pulmonary arteries. Do you know it, guys? Do you remember this? And if this thromb go to the lungs and close it, patient die directly in this time. It depends of how much how large artery it closed. For example, if it will be small artery inside the lung, it's also the patient have pneumonia on it. But if it will be great 4 or 5 centimeter long thromb that go to the lungs, it can close pulmonary trunk or right or left pulmonary artery, and patient die, and we can't save him in this situation. That's why varicosity disease is dangerous and we need to treat it. Also, we have sclerotherapy. For example, if we have first stage of varicosity disease here, we can do the sclerotherapy and close these veins themselves because they don't do their function themselves. What else? And circular roads, it's easy thing. You understand if you read themselves. Okay, guys, are you here?
Yes.
Except of Ramil. Ramil, I hear you all the lecture. Others, Nizanur, Yasmin, Itar.
Yeah, we're here.
Yeah,
Yes,
okay.
we are here.
Do you understand something, guys, from today?
Yes.
Yes, teacher, it was interesting. Teacher.
I hope it was interesting, because after that we have to, if you have some ideas what I need to do for you, maybe something faster or without details or opposite, you can tell me, because we have 2 lectures after that. I can change something. Do you have some ideas?
I actually like the details, teacher. It gives us a better understanding of the topic, in my opinion.
Again, I didn't hear you. Please.
I say, teacher, actually, I like the details you are saying, going to details, because it gives us a better understanding of the lecture and the topic.
Okay, I'm glad to hear it, because it's my first lecture. That's why I'm asking you my feedback for myself to learn something and maybe change something. If you like it, I'm glad to hear it. I hope you came to the next lecture too, because I see in the beginning you was 20 students, now only 10. Maybe someone not interesting, but please tell to others, okay, to connect next time, because next topic will be harder.